Good morning, Sir Maarten. What's cooking? October 23rd, 2023, episode 97, live from my home on a wet Monday morning. At least they made a good call keeping the children at home today, because they have been blamed for many bad calls during the weekend, which are unfortunate. But we'll talk about Hurricane Tammy, what it really meant to us a little later. Let me pick up some notices that I believe were quite interesting and do have a place on my show. And I think the first one was actually not a new one, but one of more than a year ago. And it was on Facebook, where someone had written, NEPA has a mechanic course, but nowhere in their curriculum they have a marine mechanic. On this small little island, we have over 25 marinas surrounded by the Atlantic Ocean and the Caribbean Sea. But we ain't teaching our own to become marine mechanics. Why is that? I think that was extremely nice. It was a great question for sure. And, if NEPA is listening, the Marines are listening, the Mariners are listening, maybe this is something you can answer, and then we know where we stand. Now, I don't know what's really going on, but the apartment exposure, and it's remarkable how information on the social media is being made and now is being contested in a court case, and with the slogan, "We are haters." I believe if no apartments were bought in Dubai for 700,000 and properties in St. Maarten for 300,000 and homes built for some 1.5 million, then yes, the statements made and the court cases called are correct. But is that really the case? I find it's just remarkable, to put this nicely, that we are going down this road because we don't want the truth exposed. It was remarkable to hear how the Prime Minister blew off the Daily Herald reporter last week at the press briefing, who asked a very interesting questions about the follow-up on Carbon Grove. The court verdict has absolutely nothing to do with the serious landslide possibilities that a French expert warned for by the means of a presentation in Parliament. Remember, the court case was how they have to give the apartments to the people, etc., etc. The French expert, Ripert, I believe his name was, clearly showed that serious landslides because of irresponsible excavation in the hills is a great possibility by Carbon Grove. That's the question the reporter alluded to. The Prime Minister felt offended, as she was also blamed in social media for not doing anything and allowing this to happen. Look, bottom line is this. The government is the main culprit. It's not about who did what or who signed what. In 2017, they said Emmanuel signed the permit. But signing a permit doesn't make it a crime. You know what makes it a crime? Sitting down, doing absolutely nothing when you know potential danger for human life is around the corner. And that, Madam Prime Minister, is your government for the past 4 years. So don't shake it off as if it is something different, and that the reporter, when she said the Ennia, was doing as if it was a personal attack. It's not a personal attack, it's a factual attack. Your Minister of Romy has done nothing. You have done nothing. So please, just go and explain to people why you didn't do nothing. Or the Dubai apartments part of that deal. That the Dutch puppet doesn't even know that all local shares in the one bank we called local, the Winter Island Bank, was sold to the MCB is sad. That he has to check with the CB, so with the central bank, to see if a new local bank is being established means government ain't facilitating anything for its own people. As the person responsible for the central bank, these are things you want to hope that are being checked and pushed by the Ministry of Finance. For God's sakes, the coalition party MP Rolando Bryson has said he wants to bring a local bank to St. Maarten on the floor of Parliament in meetings with the central bank that were public. I heard it too, I saw it too. So it's a pity. But maybe, since the minister don't know about all that, he can give us a better insight on budget 2023, the amended version. When is that coming to Parliament? Because right now, that's what we're waiting on, so that the police officers of St. Maarten can get their money. And like the Minister of Justice said, she don't trust this at all. So she wants to see the budget pass first before she gives any comments, because she don't trust Parliament and the amended budget 2023 being passed. So 13 years and waiting, and only God knows what's next. The whole curtain removal story. This is something that started last year, picked up this year in electoral reform by the Prime Minister, and up until today, not a peep of what's happening. Postulation Day is the 22nd of November. No laws regarding the elections can change after that. At least, let's clarify that one. You can't change anything after the 22nd of November. Seeing this law hasn't even been approved, I don't see this happening. But again, maybe this was the whole game plan from the beginning. Because if the curtains come down, a lot of people that had intentions of being elected might not be elected anymore. And talking about integrity in the elections is back up in the smoke, because no one can say there wasn't ample time to do this. This was requested over a year ago. But then again, it is these type of things that plague this government all the time and the country all the time. I had a grin when I saw the Minister of VSR proudly showing off his accomplishments at the present hospital. He showed a picture of 2016 to 2021, and then when he took over to present. And indeed, a big cistern has been built thus far. But the hospital is far from a reality. The speed he is going with and the tens of millions he has already spent, he will need 2 terms to finish that work, and another 50 to 100 million to complete the payment for the job. So again, it is all nice and dandy. Elections are coming and we're going to play on people's emotions. But again, at the end of the day, there's nothing really happening on the hospital front. And the building of 100 people, as he so boastfully stated, is a joke. It ain't true. We're going to need a lot more money to try and finish the hospital of St. Maarten. Now, this is one of the things, though, that last week, Tuesday, I went to a meeting, and I'm going to talk about it a little later, but I want to give you an intro on it. St. Maarten signed on to the Sustainable Development Goals of 2030, and the number 1 and number 2 goals were hunger relief as number 2 and eradication of poverty as number 1. When I went to the discussion of the poverty eradication last week, Tuesday, organized by the University of St. Maarten, where the statistical department, the stats of St. Maarten was there, the Labor Ministry VSR was there, the Ombudsman of St. Maarten was there, and the Anti-Poverty Platform representative was there. One thing became very clear very fast. When we talk about the SDG goal, number 1, the poverty eradication stands based on the global standard. They want to eradicate the poverty with 50% for everybody who's earning $2.15 per day. So that group has to be brought up. Please notice, in St. Maarten, nobody earns $2.15 per day for work. We have people that don't have no income, and in the census that was 5.12%. So if that's the eradication we're going to do, then let's be very clear about it. Because we have a minimum wage of 1,750 guilders per month. That is a far, far cry from $2.15 a day. But I will get into much more detail as I handle this topic specifically today. Our Generation Amazing, right here in St. Maarten, is a group of young children that are practicing soccer at the field here by Emilia Wilson based on agreements made and fulfilled with the Qatar World Cup. I am awaiting all the information so I can give a nice little presentation on it. But also, I'm going to be looking deeper at Generation Amazing, as these also include my grandchildren and other people's grandchildren and some people's children. And the questions are simple. Will there be a St. Maarten left for them, or will we sell it off all to outsiders? Will there be any environment left, or will we destroy such for greed? Will they still learn our heritage, history, and culture, or will they learn someone else? These are critical questions that someplace answers are going to have to be given. Otherwise, in reality, what are they growing up for in St. Maarten? Is there still a St. Maarten for them? You know, I spoke about the Sustainable Healthcare Act on 2 occasions. And I decided, let me go and look at it now with the answers that the minister gave to the unions. Remember, last week I spoke of the 107 questions the union posed to the Minister of VSA, all in connection with the SAHA. And I believe the SAHA stands for Sustainable, Affordable, Achievable, or Accessible Health Care Act. That's what it is. So, the minister sent back about a 40-page document, and I went through everything so that I can really look at what's really happening and where is it really going. And the answers given, the minister's intention is to pass the SAHA through Parliament before the end of the year and implement it by January 1st, 2025. I think it's based on the document and the answers. That's really a wishful thought, because there's so much that is still not clear in the document and in the answers that I don't believe Parliament can pass such a document. It is also with some reservations when I saw that the SZV fund, which is actually a special one, and it has millions, I don't want to say tens because I think it's over the 100 million in it. And they're going to take this money and slide it into the reserves of the SAHA to give, to give the SAHA a breath of life, because the sickness insurance fund and the accident insurance fund are very low. Those are the ones that are in trouble, because those are the ones that are covering basically all costs right now in St. Maarten. And the income of the sickness insurance and the accident insurance fund is lower than the expenses, making the fund on a coalition course with bankruptcy. That's also one of the reasons why they want to change this whole SAHA, but the thought behind it doesn't jive with the reality. The AVBZ fund is a special one because it is the one that covers chronic illnesses, when you have patients with very special needs that are long-term. Once it's over 90 days, you come into consideration for these coverages. Now, again, the thing is this. In the critical illness questions, three questions were asked. It was mental health, drug addiction, alcohol addiction, and any other addictions that can keep you from working. And the answer was yes, they're all taken up also in the SAHA listing. But it was kind of strange, because when you speak with the people from mental health, where mental health is considered a sickness and it is covered by the SAHA, only 10% of the members, or the people that suffer from mental health, are covered. 90% is not. And you can say, well, yeah, they can't go into the mental health facility. We're going to do outpatient treatment and so, but they're not being covered. The answer to the drug an addiction, and alcohol addiction was yes. But I'll come back to that because that doesn't make absolutely no sense what they're saying now, that is going to be covered in the under the SAHA legislation when they're telling you that it has to be approved in the mental health ordinance. So to be covered for drug addiction or alcohol addiction, the mental health addiction or the mental health law needs to be amended. It becomes very confusing because these laws are not being done at the same time, which means not everybody's going to get the coverage as it needs to be done. Again, a lot of time right now with addiction, people have to pay everything up front and then ask for reimbursement. And then when you answer with something like the fact that not because it's a disease means it's going to be reimbursed is scary. As now we have reached a point of picking and choosing who we are reimbursing. And I don't believe the law is meant that way. But the answer given surely alluded to that. So saying that they are covered is not well thought out, because some things you can cover, other things you don't want to cover. No, you got to tell them what they are going to get covered, and to tell them, well, that legislation has to be made yet means we haven't reached there at all at this point in time. Everyone is covered by the SAHA by law, regardless if you work or not, or how many hours you work. That's the basis of the law. The premium you pay is based on your salary, and for the undocumented persons living on this island, if you work more than 20 hours per week and pay taxes and premiums, you are covered. For all others, they are not insured. And this is where it comes. Interesting here is the aspect that there's no co-insurance. So if the husband is insured, doesn't mean to say the wife and children are insured. They have to insure themselves. It means it's a little different. If you have a zero income, so let's say the wife is at home, she has no income, she will be insured, but directly, not through the husband anymore. The same goes for a child. Child is going to school, so the child will be insured directly and not under the father or under the mother. So it's a direct independent insurance that you will have, and you will pay premiums if you are working. Now, what people need to understand, it is exactly that last piece I explained you. If you're not working, you're insured, is what made the SZV go nearly belly up with expenses versus income. Because all those people that are not paying a premium and still getting service is not two people. It's a significant group of children we have and a significant group of people that are not working. 9.9% was the 2019 stat that we can use and that they used in this document. That's 10% of your population. Your population is 57,000, according to the census. So, where do we go? Because they're saying government will pay this, but government don't even have money to pay its present obligations. These are the sustainable questions that nobody's answering. Everything is going government. That's nonsense. You have to understand budgetary that this can't fly. It sounds nice, but it can't fly. You have another problem here, and there was a question that the COLA increase hasn't taken place. This is primarily for the unions that questioned it, so civil servants, etc. And the COLA will have an increase in salary, and it means you're going to also have to pay more in healthcare, and they wanted to know if that was the case. Now, the thing is, government has been telling the people that they are going to be seeing an increase in their premium, but it's not really going to be increased much because government is going to take the brunt of the payment. Right now, in this law, the civil servants are going to pay 5.71% of their salaries, and 5.71, yes, and the government will pay 9% of the insurance, the premiums. So the total premiums are 14.71 moving forward. Again, there are a lot of things, because SER is one of them that has not been able to advise, because up until this day, the national decrees for the appointment of the board members of SER, for whatever reason, have not been finalized by the Prime Minister of St. Maarten. If you can recall, about 6 months, 8 months ago, go back in the Herald, read the pages, where the Prime Minister said she was shocked that the ILO rough her up and tell her, stay out of these sorts of businesses. The Prime Minister, because of whom all are going to sit on the SER, or which organizations are going to sit on the SER, was upset and decided not to sign the national decrees until today. As I speak here, October 23rd, 2023, the SER has only a chairman of the board. No more, no less. Nobody else has been assigned. Now, the SER gives advice if you want it or not, but it is not the prerogative of the Prime Minister to decide if she is going to now sign off the national decrees of people that have been legally appointed by their organizations to sit on the board or the council of the SER. It's unfortunately, but these are the things that give me a funny taste in my mouth when it comes to the SER not being able to give advice on such an important document. It gave advices in this document. They allude that they followed all the proposals that the SER made. I am not going to say their line, but I can't review it either, other than saying, because I don't have the law. Huh? Understand, I am speaking here of answers given to questions by the minister. I haven't seen the law. I'm not going to pretend that I have seen the law. I haven't seen it. I know it's 200 and something pages. So, but there are a lot of things that I know personally, speaking with people in the know, that doesn't always add up in here. But again, it is what it is. Now, when it comes to the premium coverages in this law, it's clearly answered that the premiums, 80% will be covered by the employees and the employers, and 20% will be covered by the government. Now, there are a few questions naturally that come up right away, and that is, the government already has to pay as an employer for 2,000 employees. When you pick up all the police and all the teachers and all the civil servants, you easily reach the factor 2,000. Now, we have 24,000 people working. It would mean then that 2,000 is 1/12 is about 8.5%. You're going to have to add up this 8.5% to that 20%. So now it's 28.5%. You see, government is also an employer. They're also an employer. And this is what we need to understand, that it is not as black and white how they throw it out. People that can think and people that go deeper will realize that the fund is nearly going to be supplied 1/3 by the government. And in reality is, we need to then understand, what are the costs? What does this mean for government yearly on the budget? Also, what are the costs expected to be to cover the informal sector and the many undocumented persons on this island? Now, again, remember, the informal sector here is the taxi drivers, the vendors, the bus drivers, people that at present are exempted from paying taxes, and so on a monthly basis, they don't pay wage taxes, they pay income tax at the end of the year because they don't have a monthly fixed salary. So it's very difficult. A taxi driver can make, he can tell you, I made $700 a month, which means he's tax-free because nobody controlling it. There is no control on their salaries. That's why it's an informal something. They ain't have no grip on it. That's also the reason that they were never medically insured by SZV. This law says everybody must be insured. It includes them. It means that their salaries are going to have to be fixed to something. It's going to have to be pegged to something. This is going to be interesting, to say the least. But at least, I think it's important that the people can get medical insurance. I think it's very, very important. The undocumented, that's a whole different story. Because we have right now, about in this report, in the answers given, they said about 2,600 people are registered by SZV that are undocumented on this island. The question is, how does this work with the LTU from the immigration? How is it that we are insuring undocumented people at our sickness insurance? How is this possible? We're talking about more than 10% of the insured are undocumented. And it is as if there's absolutely nothing wrong. We are contradicting ourselves with these type of laws. Because it means that anything is really possible. Even if you are here, illegal, undocumented, whatever you want to call it, you get a job and you start to pay taxes, it's okay. So why then worry about a residence permit or work permit? If we go along with allowing them to work and be insured. The fact that they are insured means they are known. Yet nothing happens. You see, these are the things that I don't understand. And it is not that I am here preaching now, oh, we'll get rid of the illegals or undocumented. No, that's not my concern. My concern is that the law is not correct. It cannot be doing. There should be a facility for such, indeed, but we got to look at this thing very, very carefully. Because we are sponsoring a bill that's going to tell the Caribbean, come to Maarten, it's okay. You will be medically insured, and we have a very good insurance compared to other islands in the world. But naturally, the question that is on my mind, does the government even have the ability for this type of budget moving forward? Is it real? Is it realistical? The answer, in my opinion, is no. In this document also, there's a thought that the government will also supplement the difference between the income and the expenses of the SAHA. So if the fund is doing bad and it didn't collect what it had to collect, the government will jump in and cover the difference to ensure that the fund doesn't have a negative balance. This is crazy because we don't even have numbers to justify this. But we write it because it sounds great and it gives the fund a livable future. But it is not giving it a livable future, it's giving it a certain debt. That's what it's doing here. Because the government should stop jumping in and trying to do things it cannot afford to do. That's how simple it is. You can't even afford to pay the police officers what you owe them for the past 13 years. But you're going to jump up and pick up a fund now of 24,000 people, and when there's a difference, you're going to pay it. I think that's wishful thinking, but nevertheless, it is what it is. You haven't even paid off APS, you haven't even paid off SZV, but we're going to now dive in and take the whole SAHA and we're going to pay for the differences when there are differences. This is craziness. These are guarantees that we can't be giving because we don't know what the end result is at the end of the year. Yet we're going to have to pay the difference because we are tying ourselves down to that right now. There was a nice little remark in between that the central bank has been added to the list of people that will oversee the SAHA. Man, the central bank couldn't even oversee Hero Bank. They couldn't even oversee the Ennia scandal. And now we're going to put them to oversee the SAHA? No, we can't be serious, man. Look. I get something look for somebody else, a better institution to do these things right now. Right now, they want to fire everybody in the board of the central bank and the directorate. So, and those are the same people you're going to put now to come and watch us. I really don't understand it. But okay, it is what it is in this report. Then there was a great question, why weren't the deducted premiums not paid to SNV? And I'm talking now about the civil servant, the OZR premiums. Why? So why wasn't it? And the answer was because it wasn't enough to cover the OZR cost. Now, that's not an answer. That's just stupidity. The answer should have read that those funds were used to plug other holes in the budget of the government. And that's exactly why I am concerned about this so-called government going to pay for all these other people and going to cover the balances when they can't even comply with present day issues. Also, the question about the private sector being part of the deficit and now more persons will pay into the fund will yield more money but not more cost is clearly, once again, a false answer. Our population is getting older. The younger generation that needs to supplement the fund is getting smaller. So the whole aspect of sustainability, in my opinion, is a complete farce. The word sustainability should be removed from SAHA and let's just call it AHA. Because I believe that's exactly what it is. AHA, another story. AHA, tis we own. AHA, how we gonna do it? This is a complete joke, people. This is a complete joke. I have people around me laughing a little bit. I won't laugh along because I laughed yesterday when I wrote it. I laughed, I took my time, I went to laugh because it was unbelievable. Even the aspect of cross-financing of the sickness fund with the AOV was brought up in this document. And the discussion there was that if it continues to go on the way it's going on now, the AOV fund will be depleted in approximately 10 years. And I don't want to say that's scary at all because it is something that we expect to happen. More people are getting older. Much less people are working to pump money into the AOV. So we have to look at the whole AOV fund and the whole AOV pension before we continue with the AOV as is. AOV was a voorziening. It was no pension. We keep talking pension, but it is not a pension because it doesn't grow. Pensions grow as you go along in age with working. It's something based on working. Not everybody has the right to take back their AOV or get their AOV paid out because for civil servants, if you get one, you don't get it. They subtract the other one from your pension and then you get the balance. But you will not get the AOV fully and the pension fully. It doesn't work so. So again, there are a lot of things here that we need to be very clear with to understand what's really going on. I think an interesting calculation is to see what the numbers were used to come to the premium increases. Because at this point in time, we're going to be paying 14.7%. Everybody's going to be paying 14.7% for their ZV, so your SFV costs, the AVBZ premiums. All of them are going to be grouped into one. I think AVVV, I think that one too is going to be grouped in. And you're going to pay one pension of 14.7. I don't know when you add up all those pensions what it really is, but it's going to be interesting what that's going to be. That's naturally beside your AOV that you also have to pay into it because that's not taken up in this fund. That's a different one altogether. And then we'll see what it really means for the workers and what it really means for the employer. Because remember, at the end of the day, the employer got to pay the extra money. And that's going to be passed on to the clientele. So right now, when you follow it, you need to ask yourself the question, okay, so how much money will be passed on towards the consumer for the services or the goods because the employer has to pay it. how much will that affect our cost of living? And how much will this affect the inflation on the country? These are questions that I believe must be answered when we are doing this, because this will have an effect on our cost of living and on our inflation. Both of them will be affected when the premiums or when healthcare rises. It is that simple. It is not something to do after the fact. Let's look at it from now so we understand what it also means for the country. With regards to the possible new tariffs, because that was also a discussion in here for the psychologists, the psychiatrists, the general practitioners, have they already been informed of what their new tariffs will be? And are these going to be used to reach the premium rates? Because the tariffs that they're going to pay the people is brought into the calculation to understand what the premiums need to be. Did these people agree to this? I saw an interesting comment that the general practitioners had already agreed to the new system. I find that kind of funny, because when I spoke to the general practitioners, one of the big boys, they said, no, they haven't spoken to us. But there's a doctor in there that writes this, wrote this law, wrote this SAHA protocol, and maybe they believe he's speaking on behalf of the doctors, but he's not. So it's going to become a very interesting development as we go along, because the answer of just, yes, we spoke to the GPs, I think that's a dangerous answer. But we'll see. Again, if the doctors said no, it's going to be a very interesting way on moving forward on how this goes. Now, another interesting something that I when I read, this was the SAHA regulates that everybody pays premium on their income. So now, let's say you have two jobs. A lot of people in St. Maarten work two jobs of minimum wage to reach the livable wage. Does it mean that you're going to pay the insurance twice? Because you work one job, you're fully insured. That's what the SAHA says. Once you 20 hours or more. So if you work 16 hours, are you now obligated to pay the 16 hours or just the first 8? If I follow the SAHA blindly, it would mean you're paying all 16 hours. Is that fair? I don't know. The SAHA also says the rich going to pay for the poor. So the high earners going to pay for the low income earners. Because everybody carries the same coverage. Everybody has access to the same medication, insurance, healthcare. That's what this is about. And that is a good something. I don't have a problem with it. But to believe that 25% of your population going to pay for 75%, I doubt that. And government, they keep talking about they're doing it, but government don't really have no money. So I don't know where we can go. The opt-out option becomes, in my opinion, a discriminatory option. For the simple fact, either everybody's insured, or we have insurance companies that are allowed to offer any type of insurance then. The opt-out right now is 5,000 guilders for the first time for the provider, and for the wife and children if they're not working, 2,500 guilders for each. Now they want to review that because they want to make the opt-out a little higher. You have to look at it as if somebody is earning 20,000 guilders, let's say we pay about 15%. So if you make 20,000 guilders and you divide that by 15%, that's about 3,000 guilders you have to pay to SAHA. You go by Nagico and you get a Nagico insurance, you pay 8,000, 9,000 guilders a year. But if I do 12 times 3,000, I pay 36,000 guilders to SAHA per year. There are a lot of people that make 15,000 guilders and up in St. Maarten. A lot of people do. So those people are going to be the first ones to opt out. And the law then says, if you want to come back later, you can come back, no problem. And then most probably you don't have that 20,000 guilder salary anymore, but you got a pension of 5,000. Then you will pay the low premium. And there will be no more 10%, which is a low premium. So you will not make use of the fund during your working time, but you will make use of the fund when you retire. That's the option they're giving. So I think that option is going to also indicate or ensure that the fund will lose a lot of money, because the rich paying for the poor is not going to be a reality. A lot of people are going to be insured by the insurance company. That we are opening a door to lose a lot of money. So it's something that has to be looked at very carefully. Again, if the fund can survive without the people that are opting out, great. But if they can't, then you are creating a false narrative very early on in the discussions. So we need to see what that really means. Then there are a few questions that I picked up that I didn't find anything in it, but the present negative list of medications at SZV, will they also be the same list for the SAHA, or is it different? The epidural injection, is that going to be free for deliveries? Is it going to be covered in the delivery care like other parts in our kingdom, or do we still have to pay the $800 at the hospital to get this injection for delivery? The question I asked it before, I alluded to it, how do we deal with undocumented people in the SAHA, and what does this mean for our laws? What does this mean for the landsverordening, toelating and uitzetting? What does it mean? Is this law going to be pushed aside so that the people in SAHA can work and live while undocumented in Maarten? Because they're insured and their coverage will continue. But what does that mean? What does it really mean? Nobody's saying nothing. These are questions nobody like to ask, but I am going to ask them. Because it is better that we know what we're up against and we don't go and start crying afterwards. Oh, but look what happened, and oh, the undocumented killing us. No. If we agree to allow this, then don't cry moving forward, because we all agree to it. These are the things that need some clarity, and they are not there. Like I said already, the vendors, the informal economy, how are we going to calculate their salaries so that they become premium? They have to pay premium to get coverage. How are we going to do that? I know they did it once with the taxi drivers with an association. They said everybody pay 1,800 guilders. Their salaries are 1,800 guilders. So it was above minimum wage. They paid premium, they paid their taxes, and everybody was happy. Maybe that's a formula to look at and use, because it might be also the good thing. But again, like I said, the SAHA, or the better name, the AHA, presently has a lot of uncertainties in it. And the claims that the government will cover lots of the health care costs, when presently it doesn't even have the funds to pay the police the 44 million guilders, I strongly disagree with such a statement. Ennia's property partially for sale. So hopefully when the parties sit down and share up the Ennia life costs and assets, they will use the proposal we made as Now Party and place our policy and pensioners under APS, and hopefully we will be able to then take over the Mullet Bay asset and move on with it. On Facebook there was and I think I saw it in the newspapers, there was a request for pricing done by a legal law firm for a parcel of land situated behind the 14 buildings for approximately 11,070 square meters. And basically the request for pricing means, can you make an offer on how much you would want to pay for that piece of land? What was also very interesting was that there was a disclaimer that the law firm, on behalf of its clients, can reject at any time, without any reason, any price for the property. That's not normally a condition set, but this one was set there now upfront, so everybody knows. You can make, let's say if you take it and you say, okay, I'll pay $1,000 a square meter, that means it's $11 million they would immediately get for that piece of land. Now the reason given was that Ennia Life or the Ennia group, let me not say Ennia, like the Ennia group has some taxes to pay and some other outstandings to pay. So they are looking at selling a piece of asset to offset these costs, because liquidity wise they have nothing. That's what I gathered out of it a little bit. And you know, I can't look in their pocketbook. I can look at how they operate though and get an idea of how their liquidity is. Mind you, nothing was urgent until come January 2024. That's when the pensions were so-called going to be in trouble. And again, that they're going to write off 80% of the pensions, that's comical. That's not true. But again, that's for a different discussion, for a different show. Pensioners will not be paid. That's not true. That's not true. People are still paying into the funds. Look, the decision was they're not going to bring the Ennia Leven insurance back to reality. They're going to put it in what they call a death house construction. They take out all the good funds, all the other things that are making money, those are taken out, and they leave that one to starve and die. That's what they're doing with Ennia Life. Curacao, who has 93% of the policyholders, decided to go that direction. This was a direction that was advised on in the past also. And that was the initial idea of the Dutch. And then for whatever reason, they changed and decided to ram the 600 million euros or dollars down our throats if we didn't take it. Thank God to Curacao that it didn't happen. But to get back to the land, like I said, you take a piece of land like this in a very prominent location, because you got building 14, that piece of land can also put 2 building 15s, for example. Behind it is the medical university. For them too, it's a great asset to maybe expand and build a dorm there. They can now maybe build a 10-story dorm. I don't know, because they need place for their students. They're renting out the whole of Jordan Village because they have 2,000-3,000 students down there. So it is a very good piece of land that they can seriously get some good money on. In town, you can buy a piece of land for sometimes $2,000-3,000 per square meter. So again, it has good value. But does it have the value for the 600 million injection needed? No, it doesn't. It really doesn't. Will they sell it off as a little piece? I sincerely don't think so. I think it was for them to get a good indication on pricing. And that means, remember, right now the courts want Smollett Bay to be re-evaluated. And they are trying to ensure that the land, when evaluated, gives an indication. Now, that piece of land is much more valuable than, for example, the golf course. It's less valuable. Up by where they used to have building 90, that's a nice piece of land, but it's not a big piece of land. When you go back to where they used to have Hillside, the condos, the restaurants, the disco, down by Puerto Cupocoy, that might be a nice piece of land, but it means that the infrastructure to all of these things needs to be upgraded and redone. And that's where the problem starts, because once you start selling off pieces, you have to ensure that there is access to the land. That's why this piece of land is so valuable, because the access already exists. So that's why they went to that choice to do that. But again, I at this point in time, I believe they're just feeling out for prices. I don't think it's going to be sold. Unfortunately though, our government went along to sign off for the loan, and I don't know in what position they're going to put us now with trying to get back Mullet Bay, because we were willing to take the loan to leave Mullet Bay by a move. Here we go. Okay, we are back on. People try to call me, then I get a problem right away. But again, like I said, selling off our assets ain't gonna work right now. I think we have to just look at what it was. I hope William was not right, and that this is a cox-up plan to take Mullet Bay from us and get it to the highest bidder that might not be on island but over the ocean. So again, there's a lot of things we need to learn. You see, we need to understand who we are playing with. When we look at the whole Ennia maneuvering of Van Huffelen going against the CFT, advice not to do this, it brought back memories to me of the same stupidity that happened in the Netherlands with the tax scandals, which caused the Rutte III cabinet to fall. You know who the State Secretary of Finances was with, specifically taxes and customs? Van Huffelen. That's the same good little lady. Come down here dancing and pretending. But boy, that's a black widow. You gotta be careful. Exactly what she did in the past is now happening with Ennia. And we gotta be very cautious how we move forward here. People don't, you see, Maarten, we have a very, very short memory. And that's the problem. We need to get off of these type of things. We need to move on. The last point I want to touch for today is there are 2 points. The SDG goal, the number one, the poverty eradication I want to talk about, and then I'm going to talk about Hurricane Tammy. But last week, like I said, there was a great program, and the whole eradication was about, the goal is about eradicating the $2.15 per day earnings that people earn, and that has to be eradicated by 50%. And we have an earning of about $973, and that's based on the numbers I got during the presentation. So I don't think we really going to be doing anything with the eradication of poverty, because it is not a sustainable goal that we need to achieve. We have already achieved it. So when we talk about eradication of poverty, let's get off the sustainable development goal. Because we all talk about the goal, but we ain't reading the goal. The goal talks about $2.15 per person earnings per day. 60-something dollars, $69. I mean, think, people, think. $70 a month in Maarten, nobody earns that. So we ain't eradicating that. What we do have is about 5.2% that has no income according to Census 2022. But we do have people living in poverty, because in our country, our standard of living is quite high. And the cost to live in Maarten has been found to be 3,550 something guilders. Now, 4 people made a presentation, Stats, Ombudsman, VSA, and Anti-Poverty Platform. All 4 did a great job. Kudos to all 4, much respect. I enjoyed the presentations, and I think the frankness in the discussions after the presentations was also very good. I want to congratulate the governor for being there. The governor was there, and on numerous occasions he was also a topic of discussion out of function by the Anti-Poverty Platform representative, and it was nothing personal, but it showed that the function of the governor is also one of the functions that is pushing the discriminations on this country, and that was quite interesting, and I'll get back to that later. Now, the Stats Department did a very interesting presentation. In their findings for the Census 2022, it was as follows. 32,056 people were surveyed. That's approximately 65% of the population according to Stats. And 13,119 households, or about 80% of all households, were checked. They were surveyed. Good. What this did is, from those 32,056 people, everybody gave up a earnings, what they earn or what they don't earn. And then you put those 32,000 numbers on a line from the lowest to the highest. You put all them down. halfway the line, that's what they call the median, it turned out to be 3,500 guilders. That means, listen carefully, 16,000 plus people earn over 3,500 guilders in St. Maarten. That's what it means. Because you're starting by 0 and you're going to the highest number. And if the median is 3,500 guilders, that means 16,000 plus people are earning over 3,500 guilders. We have 24,000 people registered by SFE. So let me take 24,000 people said they made money. Halfway would be 3,500 guilders. So we've gone from 16,000 to 12,000. That is 50% nearly of your population is earning over the livable wage. This is a stark contradiction to the anti-poverty platform, whose numbers and SZV's numbers, let me throw them in one time, where by SZV 74% earns less than 3,500 guilders. But according to the census, 50% earns more than 3,500 guilders. SZV says 25, census says 50%. And I'm saying we got a problem. The numbers by census cannot be verified. They just put them in a bracket. You earn between 1,000 and 2,000, this, that to that. Give and take. That's how it works. SFV, your salary is what's booked. So either people are underpaid by SFV or people lied in the census when they gave the numbers. It's nothing else. It's one of the two. It's one of the two things happened. But it means that the information can sometimes become difficult to work with, and stats will have their hands full to really be able to pull value out of what this means. But it goes further. The reason I went to the median was because in the formula to reach the poverty average line, you take 60%, normally it's 50, but we decided in the kingdom it's 60%. You take 60% of the 3,500 guilders. That brings you to approximately 2,100 guilders. So according to the numbers that were given during the presentation, or during the survey presentation, show that 2,100 guilders would be the poverty average line according to government. Based on a minimum wage of $17.50, that means not bad. You're a few hundred guilders off. Not 1,700, but 250 guilders. You're under it. Now in this same survey, the expenses that every household family had was 3,551 guilders. So the poverty minimum line was 2,100 guilders, and the expenses are 3,500 guilders. Minimum wage, that's out of the picture self with my hands, it's out because it's $17.50. What does this show you? It shows you that we are having a very serious review in numbers here, but also we need to understand what's really being said and not being said. I don't know where this is going to go, but I know it is one of those big question marks right now. Another interesting finding was that about 7% of the income of people in St. Maarten surveyed is spent on food. And that was because they pay everything else, then they buy food or whatever stays over. The average in other countries in the region around us is about 20%. Now, this is one of the things that you want to look at, because hunger relief is goal number 2 of the SDGs. And the census also revealed that at least 12.3% of all the people surveyed. Now, mind you, that study 2000. So over, let's say, close to 4,000 people stated that at one time of the year in the last 6 months, they skipped a meal because they didn't have food. That's the matter. Do we have poverty? Yes, we do. Once you have people skipping meals because they can't afford it, because they are paying for other things before, you got a problem. And this also revealed that those that were hungry and didn't eat, on average, was about 7.1% every month, give and take. That's a lot of people. That's really a lot of people that are having this. So, we have hidden poverty. But people don't like to talk about it. And thank God the census doesn't use names. It does use locations, so areas, demographics, man, woman, age, those type of things, income, where you live in, give and take. But again, it shows you that we have poverty and it does exist. And the data that was used, or the databases that the census used to verify information that they got, were from GB, SFV, FROME, and the Civil Registry. So some of those databases also left a lot to be desired, because it seems to have been a crazy house. But you see, where I'm trying to go with this is, I told you just now 32%. 32,000 was about 65%. When you do that and you interpolate it to 100%, you reach to 49,000 people that should be living in Maarten. We have 57,208 registered at census. This also includes people living abroad, in the States especially, people living on the French side, most probably in Anguilla, I don't know. We have a lot of them. Haiti, Santo Domingo, they're living there, most probably collecting their AOV monies there, but they're in the database by us. We know for a fact 2,600 are undocumented, working for SFV, and they are not in the database. So how does this work actually? How do these numbers really know? How do we verify this data? How do we make this data usable? Don't ask me, I don't have the answers. The professionals, I'm sure they have the answers. There are ways to do this. We're not the first country with these type of things, so I'm sure we have other things that they can do this. But it's concerning, because the Ombudsman, in her presentation, gave a lot of concerns and things, but what was important was the survey that the Ombudsman did. The Ombudsman did a survey among 50% of persons affected by a national ordinance, that's civil servants. Putting it nicely, she surveyed 50% of the civil servantry, which indicated that 97% is very concerned that they will not be able to provide adequately for their families in the future, the way things are going. 97%. That's a scary, scary number. And 87% responded that their quality of life is poor or maybe average. These are crazy numbers. But the Ombudsman did a survey. This is what rolled out. If this is not reason for concern, then I don't know what is. But the government wasn't there. There was one member of the coalition there, MP Pantaflet, one member. There was nobody at the panel discussion from government, nobody at all. Because naturally, there, the scary things were going to be released. The not so popular things were going to be released. Again, another scary thing that the Ombudsman went at, because these are problems that they very most probably get themselves confronted with, was that a lot of people in this country has no social safety net. So when somebody loses their job, they fall into debt very fast into deeper financial trouble and eventually break the laws to make ends meet. And there's a problem with that, and it's a growing problem, and the Ombudsman is asking that we look at this. We need to teach people how to budget and pay off their debts and keep them falling out of unpayable debt, because at the end of the day, they're going to be in trouble. Banks going to be in your face borrowing your money for cars. And when you don't pay, they come for the cars and they come for anything else. Also, the immigration system doesn't work the way it has to work, because the Ombudsman says, why are people paying premiums while being undocumented and not receiving proper treatments? So they are paying, they're undocumented, they're paying the premiums, they're being withheld from their salaries, most probably not turned over to SFV, but they can't go no place. They can go to the Ombudsman, because they go immigration can put them out. Common practice seems to be here, according to the Ombudsman. The quality of education was also, in particular with kids with special needs, was lacking. And if you all can remember, a few months ago, 6, maybe a little more we were talking about the special needs education and how the Minister of Education said he had it all solved and he was going to put them in different schools. Those children, it ain't working. The Ombudsman has realized that these kids are just put in another classroom, but it ain't working. The teachers aren't there, the needed materials aren't there. And once they finish primary, there's no place to put them for secondary, because the vocational training school used to be that go-to school. But that has now become a school, according to the Ombudsman, for children with behavioral problems, not special needs. So they can't go there, otherwise they'll be bullied to death. Again, these are problems that we need to look at, because parents spend every cent they have to try to find a place for their children to be educated or being taken care of, and it just puts them into poverty. It might sound, nah, that ain't true. It is a reality. People do anything for the children. They lie for the children, they'll steal for the children, do anything for the children, protect them from committing horrible crimes, lie for them. So why not pay for them and don't eat? Why not? Again, the Ombudsman also asked if we would be willing to strengthen the relationship with our senior citizens for better care, and especially regarding poverty. Many of our seniors are living in poverty. And the Caribbean Netherlands cost of living is much higher than those of here in St. Maarten. Yet, the elders are now crying out for support every day to be able to live. Again, like I said, it was a very, very interesting one. But the Ombudsman concluded that the government can do much more. The government has data, but it doesn't share the data, nor does it coordinate the data with others. And that's the reason the Constitutional Court told St. Maarten that our minimum wage is probably higher than our livable wage. Mind you, a livable wage that is set at 3,500 guilders. The Constitutional Court, when they brought in the 3 laws that the Ombudsman challenged, were told, because you all don't have data to show that the minimum wage is not a livable wage, we are going to assume that the livable wage is below the minimum wage. And as such, our laws were upheld. But then came the anti-poverty platform representative, Mr. Yuzurun. And I honestly will say this. I've had my differences with Dr. Ramdas Raymond Yuzurun. He was in Parliament, and he did come and say that the livable wage was 3,500 guilders, and he did bring up a lot of things, and I was quite critical, to be very honest with you. And let me use this platform here to say I was wrong. Mr. Yuzurun was right. And people say, well, you don't have to say it. Yes, I have to say it. I was one of the critical ones in Parliament. The others, they just stayed quiet. They don't say nothing. I challenge things when you tell me them if I can't find myself in them. But on Tuesday night, the question was, can we eradicate poverty by 2030? And nobody else of the previous three panelists said yes. But Mr. Yezerun said, yes, we can. And Mr. Yezerun went down a whole different road. I don't think anyone really expected the road he was going to take, but he caught me somewhat a little off guard. But I was happy that he did, because it opened my mind and I looked at what he was saying from a whole different view. But he showed all of us, including His Excellency the Governor, that we are not standing up in St. Maarten for equal rights, as laid down in the various UN regulation, human rights treaties, our own Kingdom Charter, and our own St. Maarten Constitution. He went as far as giving his departure points in the following. St. Maarten is a territory under the jurisdiction of two European colonizers. Netherlands and France are founding member states of the United Nations. Everyone in the state has equal rights. Poverty is a human rights matter. Those were his 4 departure points. I think the first one already, you say, wait, St. Maarten is a territory. St. Maarten is a territory. The United Nations speaks of territories. And the Kingdom of the Netherlands knows various territories. Territory Aruba, Territory Curaçao, Territory St. Maarten, the Territory Netherlands, and the 3 islands that fall within the Territory Netherlands, and they call them special municipalities or whatever they want to call them. The reason I'm saying territories is because while the Netherlands is a sovereign territory, and we might be called an autonomous territory, we are still territories within one state. And that state is the Kingdom of the Netherlands. And it is that departure point that makes the discussion so interesting. Because all these departure points were substantiated with facts like the state's obligation is to respect, to protect, and to fulfill human rights. To the respect as codified in the Kingdom Charter, Article 43. If we all know Article 43, it says when there's no good governance, when there's no safety. And the last one, what was it? Oh yeah, when their human rights are being trampled, the state steps in. So the state is responsible for human rights. We love the stupidity of when Van Hoffelen say, oh, every country has to deal with it themselves. We are not a country, we are a jurisdiction. You see, the problem is this. All the wise men we have walking around here seems to have drank that colonizer's juice and seem to not want to stand up for the country and not say, right is right, wrong is wrong. Again, in the Dutch Constitution, Article 49, and in our own Constitution, Article 81, these are obligations, and they are based on UN treaties and conventions and not declarations anymore. Or ILO treaties and conventions and not recommendations. This is the problem. These things are now fact. Not maybe we can do this or maybe we should do that. No, no, no. It is their obligation. There's one state, Kingdom of the Netherlands. And when you read the Constitution of the Netherlands, everybody is below that, including St. Maarten. Including St. Maarten. All civil, political, social, and cultural rights should be equal for all, but clearly they aren't. Our unequal social security and social protection clearly shows in our minimum wage, in our healthcare benefits, in our child allowance, pensions, widowers and orphan pension, and social allowances, which are easily 50 to 60% lower than that in the country, the Netherlands. Article 2 of the Human Rights Declaration clearly states that non-discrimination isn't allowed. Yet we practice it every day in St. Maarten. Because every day we are discriminated by the wages we get, the health care we get, the pensions we receive, etc., etc., etc. Article 22, which is the right to Social Security, isn't there, as our Social Security has us living in poverty. And Article 25, which is the right to adequate standard of living and health, is only wishful thinking, as presently our minimum wage is about half the needed livable wage of 3,500 guilders. You see, when you start putting the laws in perspective to the realities, things start to change. Now, another interesting observation was the Article 29 of the Vienna Convention on the Laws of Treaties, where unless a different intention appears from the treaty or is otherwise established, a treaty is binding upon each party in respect of its entire territory. So for us, unless we have different things than the Vienna Convention treaty, the laws of the treaty, then everything should be the same. And to my knowledge, we don't have deviations. What we do is we throw in things like, oh, that's yours, you got to handle that yourself, and oh, this is mine, you got to handle that yourself. Again, is it in contradiction to international treaties? Also, differences allowed by territorial autonomy, if any, are clearly stipulated in the articles of so well the Dutch Constitution and the articles of our state regulations, because we have a staatsregeling that we like to run, jump, and call Constitution. It's not a Constitution. It's not. It's a state regulation. Again, there are a lot of different things here now that have started popping up in the discussion and the presentation of Mr. Dr. Anders Raymond Jeroen. I think we can eradicate poverty in St. Maarten, he said, once we apply the international public law obligations like the UN Charter, Article 73. You all can remember that one? Where there was this big uproar in Parliament when the UP faction, that time Grisha Heiliger was still there, and Rolando and all of them went and hired persons to fight at the United Nations with Article 73, and the Dutch government went ballistic, and Knops pack them up and all kind of crap. You know why? Because it struck a nerve. And the Dutch don't like to be embarrassed internationally. And it struck a nerve. Because up until today, that is not regulated properly. When you take the ICCPR, that's the International Covenant on Civil and Political Rights, Article 2 and 26. Remember, our parliament refused to stand up when I sent a letter telling them that they cannot suspend me from Parliament for a crime that I was allegedly convicted for, and I am fighting it in the courts of law. You know what the answer was? Oh no, we got so many other things to go change in our constitution, we ain't gonna pull that one forward. But it is something that you have to adhere to. Think about you gonna pull it forward. You never did it. You found the cowardly way out as Parliament. You are the ones representing our people. You are the ones keeping our people in oppression. So be careful when you talk. Then you have the ICESCR, the International Covenant on Economic and Social and Cultural Rights, Articles 2, 6 to 11, and Article 12. Now, this one is a critical one. Why? Because this covenant, this international covenant, says when you have a deficit in your budget, when it comes to economic, social, and cultural rights, the state should supplement the St. Maarten budget with funds to ensure that they can meet the the human rights of their citizens. These are international covenants that the Dutch state has signed on to. They signed on to it. And we, by extension, because we accepted what the Netherlands Antilles had after 2010. We just took over everything, so we were in compliance, so-called. Again, then you have the ICERD Article 1, the International Convention on the Elimination of All Forms of Racial Discrimination. Now, the Netherlands has the 10th highest ranking in the world qua Human Development Index. Yet we are nowhere to be found on this list, and the Bahamas has a position at number 55. That's the only one in the Caribbean that's that high. There are so many obligations that the kingdom has to fulfill and it doesn't fulfill. Based on the Kingdom Charters, Article 2, 29, and 43, the UN Charter, the ICCPR, ICESRCS, and the ICERD. And we even have our own state regulations, Article 22, 81, 99, 100, and 102. Also, the rules of procedure governing the governor of St. Maarten shows that our own governor can send up many of these laws for annulment because they are in conflict with our basic human rights and are discriminating us. I wonder if we will see that happen any day soon. Hurricane Tammy, what's the story? Look, I've been around hurricanes for a good part of my life. I think I know a little bit about them. I think I know what the carnage can be, and I know, when we are lucky, how it feels. But we seem not to be learning our lessons well enough. We were spared by Tammy, and we haven't gotten the rain really that we thought we would have gotten. And today the schools were closed, and that was a good call. And some people say, oh, every time they're doing this stupidness and they're closing down the place and the economy of this country. Well, you see, you could do two things. We can say a life is worth so much. So if we lose 5 lives, it ain't a big thing because the economy needs so much millions. If that's the way you want to run the country, then I think you should get on a list, get elected, and go do that foolishness. But the EOC and the Prime Minister as chair of the EOC has a job to do. And that job is to ensure that every citizen of this country is safe during the passage of any type of storm. The EOC gets their information from the meteorological services. Those are the people that are educated and trained to make a call. You have never seen me contradict the meteorological department. What I complain about very often is our inability to get ready, to clean the trenches, to open shelters, to make sure we got stormwater pumps. Those are things that I talk about. Because those are things that we can do, that we don't need to wait for a storm to come. You got to understand, up until today, the waterways are not ready. 3.5 years later, we still have no pumps. Hurricane coming, one shelter is opened in an area that very often you might not be able to reach because the roads leading to the John Lamini Center can be flooded. These are things that you need to understand when you're doing shelter management. And the people that are doing the shelter management, I am sure they understand that the roads going to a shelter are the most important things during a storm for somebody to get to the shelter. Opening a shelter and everybody checking early, that's the good part, that's the organized part. But most people don't do that. They stay by their house until the last minute. Why? Because they're afraid that if they go and come back, they mightn't meet anything inside their house. That's the reality of it. But then we had on Friday an incident where the the place was going to close at 12 o'clock, and they said the weather wasn't coming anymore, so They're going to open up everything and close everything on Saturday, midday. And EOC made that call. While I didn't support the call, I respect the call because it's EOC's call to make. I just believe that we sometimes are influenced not by the weather per se, but more by those in the business sector that have certain interests and wanted certain things to happen. That's the difference. That's my beef with these type of things. When I used to be in EOC, I voiced my concern because sometimes greed takes the better of people and people's lives are put on hold. But again, everything is possible and it is what it is. We were spared by Hurricane Tammy. I'm grateful for that. I'm thankful for that. I hope all of you also are very thankful for that because it was a great day when that hurricane stayed to the east of us. What do we expect? What are we sharing for elections? Right now, we're sharing a lot of jokes and we're going to open Pandora's box. So we have a court case pending about slander and defamation against an outspoken activist, freedom fighter, whatever they want to call them, who has a lot of followers that are speaking out on his behalf while he's off island. This good gentleman has been summoned to courts, I believe, this month while he is out working in another country. How that going to work out, we will see. But the questions that I have is how far does freedom of speech go? In the Netherlands, we have seen people being called mafia, and Maarten is a set of mafias. We used to sell them for €1 and all kind of things. A member even went to Holland, took a second chamber member to court. The results were clear. Nobody cared. In my court case, we were told that we stole $2.3 million from the government or guilders or whatever, front page articles. When we went to the judge said, high trees catch a lot of wind. So how far does freedom of speech go? You see, we forgot the tapes that circulated, I think about a year plus now. It happened after the November 2021 meeting. Let me see. Am I saying that correct? Yeah, November 2021 meeting, where Minister Doran and the group for the Vineyard Heights, he got a warning from Parliament, and MP Bryson went on a rampage, and tapes were made from things that he said among his friends about what he thought of Grisha and her husband and the deals and all kind of craziness. I can't recall the Prime Minister jumping up and saying something then. I can't remember it. Maybe she did. Maybe she said, stop it. Not in my government. You don't talk so about women in my government. I can't recall that. What I can recall is the hypocrisy. Because now, we're jumping up and we're going to courts. And again, I'm going to say it. How far do we go with freedom of speech? Are ministers safeguarded from exposure when things don't logically add up regarding their wealth and income? Are we not allowed to ask about this? Is this now slander? Is this now defamation? Again, let me be very, very clear with something. I don't support, and you see I don't call names very easily of people. I don't support implicating family members and all kind of things in discussions. The politician, he knows that in the political arena, everything goes. We try to pretend that we civil. But when that bell goes, come nomination day, all going. And we all know it. And we got to prepare for it and deal with it. Otherwise, get out of this race because it's going to be a nasty one. This election is going to be a nasty one. It is gearing up to this completely. You must understand something, people. When a high council in St. Maarten, the ombudsman, writes a report on garbage collection and emphatically states that there was fraud, corruption, non-transparency, etc., etc. I can't recall hearing the Prime Minister or the Council of Ministers opening their mouth. To the contrary, they dragged a sick MP from Panama to vote to save Minister Doran from getting a motion of no confidence. But when somebody questions it and goes and takes a picture of the house, it's slander and defamatory. You know what's criminal? When we cover blatant corruption, when we hide a report from a high council in this country, then why have them? You see, these are the problems. Are conversations between persons private? If I have a conversation with you, do you have the right to take my conversation and pass it on to a third party and then tell me I am liable? Because that's what's being claimed now. Like I said, I don't support this way of bashing. But politicians gonna have to get accustomed to it because it's going to become the norm of day. Why isn't the regulations for the curtains being brought down, not handled yet? Are we going to continue supporting what's happening? Because we all know what's happening. Let's not pretend. Let's not be childish. Let me close with this. Every week, I'll give you a little taste of what the Now is going to be doing. And last week, you can remember I spoke about the U.S. preclearance that we stand for, no more taxes on pensions of our seniors, the subsidy program to ensure that everybody can reach the 3,500 guilders livable wage per month. And we will do that with subsidies on be it medical coverage, housing, food, utilities, transportation. Getting our National Museum in the center of town once again and build a courthouse and a justice wing in collaboration with APS on the Now parking lot. Tax reform to leave people with more money in their hands so that they can do better things with their money than pay taxes alone. A national sex offenders registry, our own prosecutor general and a shared common court with Aruba and Curacao, a Ministry of Agriculture, Fisheries and Animal Husbandry, and the animal cruelty law that is ready to go. Our path to independence will be decided with a referendum. Our own drag strip and drifting location with a full tribune. A new waste-to-energy plant in collaboration with NVGB, and a recycling and reuse system operated by our own people for various streams. Revival of the offshore market and financial banking services industry within the norms of not becoming a tax haven for money laundering. The development of the orange economy for our artists of all walks to be able to make a proper living and be part of a vibrant economy. These are some of the things that the Now Party will be doing once we get into government. And our total manifesto, the full manifesto, will be ready come November 22nd for distribution digitally and hopefully also in paper format. The last one, we got to find the sponsors to ensure we can do that. Other than that, I need you all to take care, share my podcast. I want to leave you with this saying. Take care, and until next week, I'm out. Have a great day. See you all.